Okay. Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are joining virtually to adhere to social distancing guidelines. And we will begin our briefing today with opening remarks from Managing Director Brian Abernathy. Brian?
Thanks, Mike, and good afternoon. The city has received many complaints about fireworks going off at all hours, disrupting sleep, causing anxiety in people and pets, and generally interfering with residents' quality of life. This isn't just a problem in Philadelphia. New York, Baltimore, and several other northeastern cities have also reported huge spikes in fireworks complaints. It's unclear why this is happening. And what I do know is that fireworks are incredibly dangerous. They can cause catastrophic fires and devastating injuries. Many of you covered stories last summer involving a 9-year-old Philadelphia girl who suffered life-altering injuries and a 12-year-old boy who lost a finger after playing with explosives. Some of you might remember the young man who lost sight in one eye after picking up a firework during the Eagles Super Bowl festivities in 2018. So fireworks are not harmless entertainment. That's why the Philadelphia Code historically banned the use and sale of fireworks within the city. Unfortunately, state legislation from 2017 forced Philadelphia to legalize consumer fireworks. Nevertheless, Philadelphia can and does substantially restrict fireworks in certain ways. The city fire code bans the use of consumer fireworks within 150 feet of occupied properties. The fire code also prohibits people from setting off fireworks on public or private land without permission of the owner. High explosive fireworks, known as Class M, such as M80s, are illegal in the city and, again, incredibly dangerous. It's also against the law, and did I mention dangerous? To sell fireworks on the street without a license. We understand the last few months have been a very difficult time with restrictions only now being eased. We understand the absence of an in-person Welcome America festival may cause some to truly crave the excitement of an enormous fireworks display over the river. We get all that. But the simple fact is that these are extremely dangerous products, and the risks far outweigh the momentary excitement of the explosions. If residents observe high explosive fireworks or fireworks close to occupied properties or otherwise wish to report a late night noise violation, or if they witness sales of fireworks, please call 911 or call their local police district. The police will investigate reports of such activity when it's reported. However, please keep in mind that enforcement is extremely difficult, particularly since the folks setting off some of the fireworks have usually left the area by the time officers arrive. So I'm asking all those people who set off those fireworks to remember their neighbors and to keep themselves safe and leave the fireworks at home. Now I'll turn it over to Dr. Farley for today's COVID-19 update.
Thank you very much. There is mixed news about the epidemic today, with cases surging in many parts of the United States. The impact on Philadelphia so far is unclear, but there are plenty of reasons to be concerned. First, let me give you an update on the local numbers. Now, since this time yesterday, we matched our local database with the state health department's database, which enables us to pick up cases of infection that were reported previously, but now have been newly identified as Philadelphia residents. That gives us an increased number of cases that we would report in a single day. So since this time yesterday, we've identified 219 new people with the coronavirus infection, bringing us to a total of 25,335 since the beginning of the epidemic. Of the 219, approximately 100 are previous cases that are newly identified as Philadelphia residents, and about 120 are recent, that's to say the past couple of days. The same process enabled us to identify 37 new people who died from the coronavirus infection, bringing us to a total of 1,563 since the beginning of the epidemic. Now, more important than any individual day's number is the overall trend. And the cases last week averaged about 100 per day, which is still falling from what we were doing before, but it's falling just slightly. The number of people who are tested who then test positive, that percent is about 5% now. Across the region, case counts are falling in Montgomery County and in Bucks County and in Delaware. However, the epidemic is going very much in the wrong direction in most of the United States. U.S. case counts have risen more than 30% in the past 14 days. Case counts are rising now in 26 states in the United States after reopening. couple of examples of Florida and Texas, after having an initial peak of about 1,000 cases per day in April, they had a fall. Now they're peaking again at about 4,000 cases per day. And the epidemics there are not just in rural areas, they're also in cities like Miami and Houston. Those are hit particularly hard. And case counts are rising also in some parts of Pennsylvania and in Delaware and in southern New Jersey. So with all that happening, this will have some impact on Philadelphia. We can't say when, and we can't say how much. So the main message today is that this epidemic is definitely not over. The risk right now is rising. So we all need to take this seriously. Businesses and people who organize activity need to take our safe mode guidance seriously, and individual people need to take our mask, distance, hand washing message seriously. Now, let me just give you a little bit of an update on where we are with our strategy for fighting the coronavirus infection in the city. Remember, our strategy has three parts to it. There's containment, there's social distancing, and there's protecting vulnerable populations. Containment includes testing, contact tracing, isolation, and quarantine. As far as testing, we are expanding our testing access. That's continued. We now have more than 50 sites across the city of Philadelphia. And in the last week, we averaged about 2,100 tests per day, which is a new high for us. The previous high we hit in late May before the protest was about 1,900 tests per day. Contact tracing, remember that process is interviewing cases, finding out who they might have exposed. Those people we would refer to as contacts. Then identifying those contacts and trying to reach them and see if they can get them to go into quarantine so that if they develop the infection, they don't in turn pass it on to others. Now that takes a lot of staff time to do. And we've been, in the past few weeks, building our infrastructure to do that. In particular, we've been hiring staff. So we now have 58 staff we've hired to do contact tracing. And we hope to have 83 staff by July 6th. That staff is very diverse, which we need for a very diverse city. The staff that we've hired so far, 51% are African American, 27% are white, 7% are Latino, 11% are Asian. Of all that staff, 23% were born outside the United States, and 39% speak a language other than English. So that we hope that all of our staff can really speak to the people who are cases or contacts in their language, both literally and figuratively. We're now in the process of training that staff. Now that staff has to maintain an awful lot of information these days to keep track of a lot of information as well as communication. You need specialized software. Our specialized software goes live today, and we hope that with the staff being trained recently, the software going live today, that we will be fully operational by July 1st. In the meantime, we have been piloting our contact tracing work to learn from that, as well as working with people at Penn Medicine who've been doing contact tracing for their own patients. And I'll give you some sense for how the process is working so far. Of the cases that are reported, between 65 and 70% are reached. You don't always have good information in order to reach people. Of those who are reached and are interviewed, we're averaging about 2.4 contacts per case. Those are the number of people who might have been exposed and might be able to get the infection. We then try to reach those contacts, and about 60 or 75% of them we are able to reach based upon the information we have. Now, those are a starting point. Based on our pilot, we hope to improve all those numbers as we get better information and as we train up and learn more about this process. Now, let me update you on social distancing. Just to remind people that we will be restarting some activities this Friday, a limited number of activities. That includes residential swimming pools and private swim clubs. It includes personal services, specifically beauty salons and barbershops and nail salons. And it'll include small indoor social and religious gatherings of up to 25 people. Guidance on how to do that safely is on our website, just posted today, www.phila.gov/COVID. Opens it up, and there's many things you can get from there that specifically look for guidance. Now, according to our plan, we go to green if we meet our targets laid out in our green plan by July 3rd. Now, it's important to emphasize again, as I emphasized last week, that going to green does not mean that every activity is allowed, and green in Philadelphia will be more restrictive than green across the rest of Pennsylvania. Be more restrictive in what activities are allowed and in how they take place. In view of the rising case rates around the country, it's particularly important that we be very careful as we reopen any activity. So people have asked me, why is it that Philadelphia is any different from any other part of Pennsylvania? Just to remind people that Philadelphia is unique. We're the largest city in the state by far. We're the most densely populated. We have a high poverty rate. We have a very diverse population. And we've had the highest case counts throughout this entire epidemic. So we don't want to become another Miami. another use it. We want to truly reopen with care. Our Reopen with Care plan summarizes the activities that are scheduled to restart with green. That's on our website. And guidance for all those activities that are scheduled to reopen in green is also going to be posted on our website later today. So more information on all of this, as well as that guidance, is at www.phila.gov/COVID. Thank you.
Very good. Thank you, Dr. Farley. Now we go to Armando for the Spanish language translation of Dr. Farley's and Brian Abernathy's comments.
Mensaje del director general Brian Abernathy para el martes 23 de junio del 2020. Buenas tardes a todos. La ciudad ha recibido muchas quejas sobre fuegos artificiales a todas horas que afectan a nuestros residentes. Interrumpen el sueño, causan ansiedad en las personas y en sus mascotas y en general interfieren con la calidad de vida de todos. Y este no es un problema solo en Filadelfia. Nueva York, Baltimore y otras ciudades también han reportado gran aumento de quejas por el uso de fuegos artificiales. No queda claro por qué está sucediendo esto. Lo que sí sé es que los fuegos artificiales son increíblemente peligrosos. Pueden causar incendios catastróficos y lesiones devastadoras. Muchos de ustedes siguieron historias el verano pasado respecto a una niña de 9 años que sufrió serias lesiones y de un niño de 12 años que perdió un dedo después de jugar con explosivos. Algunos de ustedes recordarán al joven que perdió la vista en un ojo durante las festividades del Super Bowl del 2018. Por tanto, los fuegos artificiales no son un entretenimiento inofensivo. Por ello, se había prohibido su uso y la venta de fuegos artificiales dentro de la ciudad. Desafortunadamente, la legislación estatal del 2017 obligó a Filadelfia a legalizar los fuegos artificiales. Sin embargo, la ciudad de Filadelfia puede y restringe sustancialmente la venta de fuegos artificiales bajo las siguientes condiciones. El Código de Incendios de la ciudad prohíbe el uso de fuegos artificiales de consumo dentro de 150 pies de propiedades ocupadas. El Código de Incendios también prohíbe a las personas encender fuegos artificiales en terrenos públicos o privados sin permiso del propietario. Los fuegos artificiales altamente explosivos, conocidos como los de clase M, por ejemplo los M80, son ilegales en la ciudad y, repito, son increíblemente peligrosos. También es ilegal y es peligroso vender fuegos artificiales en la calle sin licencia para hacerlo. Entendemos que los últimos meses han sido muy difíciles, con las restricciones que ahora estamos levantando. Nosotros entendemos sus preocupaciones, pero el hecho es que estos productos son extremadamente peligrosos y los riesgos superan con creces la emoción y la belleza de los colores de los fuegos artificiales. Si los residentes observan fuegos artificiales altamente explosivos o fuegos artificiales cerca de propiedades ocupadas o de alguna manera desean denunciar una violación por ruido a altas horas de la noche, o si son testigos de la venta de fuegos artificiales, pueden llamar al 911 o llamar a su distrito de la policía. La policía investigará los informes de dicha actividad apenas se reciban. Sin embargo, tenga en cuenta que la aplicación de la ley es extremadamente difícil, especialmente porque las personas que venden o detonan fuegos artificiales generalmente han abandonado el área cuando llegan los oficiales de la policía. Y esta es la actualización en materia de salud para el martes 23 de junio del 2020. Buenas tardes. Estamos preocupados por el estado actual de la epidemia en los Estados Unidos, por el repunte de los casos en el país. El impacto que esto tendrá para Filadelfia no nos queda claro en este momento, pero estamos preocupados. Primero, comienzo con los números locales. Hicimos un cruce con la base de datos del estado desde ayer, identificando casos y muertes con residencia desconocida pertenecientes a Filadelfia. Desde ayer se han confirmado 219 casos de coronavirus en Filadelfia y actualmente tenemos un total de 25.335 casos en la ciudad. De este número, aproximadamente 100 casos no tenían residencia identificada anteriormente. Lamentablemente, también reportamos 37 fallecimientos por el COVID-19 en la ciudad. Hay un total de 1.563 personas que han muerto por el COVID-19. La tendencia es que el número de muertes disminuya. En la región, los casos están disminuyendo en los condados vecinos, en Delaware, Montgomery y Bucks. Sin embargo, la epidemia va en dirección contraria en varias partes del país. El número de casos a nivel nacional aumentó en un 30% en 14 días. Los casos van aumentando en 26 estados después de su reapertura. La Florida y Texas iniciaron con un pico de 1,000 casos diarios y ahora reportan un promedio de 4,000 casos por día. Y no estamos hablando de ambientes rurales. El virus está atacando fuertemente a las ciudades. Miami y Houston se han visto severamente afectadas. Los casos también están aumentando en otras partes de Pensilvania, en el estado de Delaware y en el sur de New Jersey. Y esto impactará a Filadelfia, aunque no podemos decir cuánto o cómo. Mi mensaje, por lo tanto, es: la epidemia no ha terminado y el riesgo sigue siendo elevado. Es necesario tomar medidas de reinicio de modo seguro seriamente, especialmente el uso de las máscaras. Nosotros continuaremos con nuestra estrategia: la contención del virus, la promoción de la distancia social y la protección a los más vulnerables. Para la contención, la disponibilidad de pruebas, el rastreo de contactos y la cuarentena son elementos críticos. Tenemos más de 50 centros de pruebas y en un promedio realizamos 2,100 pruebas diarias la semana pasada. Con respecto al rastreo de contactos, entrevistamos a las personas enfermas, tomamos la información de las personas con las cuales ellos tuvieron contacto y hablamos con ellos y les recomendamos la cuarentena cuando sea necesario. Esto toma tiempo y dedicación de todos nuestros empleados. Estamos construyendo la infraestructura y estableciendo los protocolos para poder hacerlo correctamente. Hemos contratado a 58 personas hasta el momento. Nuestra meta es contar con 83 personas para el 6 de julio. Filadelfia es una ciudad diversa y su personal debe reflejarlo. Tenemos un 51% de afroamericanos, un 27% de blancos, un 7% de latinos, un 11% de asiáticos. De estos, el 23% son nacidos fuera de los Estados Unidos y el 39% hablan otro idioma además del inglés. Sobre la capacitación de este personal, manejarán mucha información y estamos obteniendo del Departamento de Tecnología computadoras y software especializado para que puedan hacerlo. Y todo esto estará operativo el 1 de julio. Mientras tanto, estamos trabajando con Penn en nuestro programa piloto. El 15% de los casos en los entornos congregados ya han sido entrevistados. Entre el 65 al 70% de los casos han sido contactados y en promedio cada persona en estos casos ha tenido 2,4 contactos. De estos contactos, aproximadamente el 75% de los casos han sido localizados. Nuestra meta es mejorar estos números con una mejor calidad de información. Para esto, la distancia social es clave, puesto que muchas actividades se realizarán este viernes. Las piscinas residenciales y los clubes de natación privados abrirán, así como los salones de belleza, las barberías y los spas. Las reuniones sociales y religiosas con un máximo de hasta 25 personas. Y pasaremos a la fase verde si cumplimos todos estos objetivos el día viernes 3 de julio. La fase verde, sin embargo, no significa que todas las actividades sean permitidas. La fase verde para Filadelfia será más restrictiva que para el resto de Pensilvania en términos de qué y cómo se reanudarán ciertas actividades. ¿Por qué tomamos esta decisión? Porque Filadelfia es única como ciudad. Es una de las ciudades más grandes y más densamente pobladas del estado. Tiene una tasa de pobreza muy elevada. Su población es muy diversa y tiene un conteo de casos bastante elevados. Nosotros no queremos convertirnos en otro Miami u otro Houston. Nuestro plan de reapertura con cautela resume las actividades permitidas en la fase verde y está disponible en nuestro sitio web. Las directrices específicas para las actividades serán publicadas en la tarde de hoy en fila.gov. Y solo con su ayuda lograremos volver a la normalidad y juntos enfrentaremos y triunfaremos sobre este reto. Muchas gracias.
All right, thank you, Armando. We are now going to move to the Q&A portion for members of the media. Please limit your questions for the moment to topics related to the COVID-19 pandemic. If time permits, we will open the floor later to other topics. So if your hand is raised right now and your question is on another topic, please lower it and we will try to get to you later. Please remember we have limited time during the briefing, so only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. For those logged in today, use the raise your hand feature found under the participants list, and we ask that when you're called on, if you are, please allow the please use the video function so we can see you. Let's now go to Fox 29.
Yeah, for Dr. Farley, please. Dr. Farley, you said that the rise in other states will impact Philadelphia. You just don't know when or how. So is it inevitable Philadelphia will see a spike in cases when you go modified green Friday and full out green the following Friday?
Nothing is inevitable here, and there's a lot of uncertainty. I can simply say that we are concerned about the trends, and there's a real risk that cases may start to rise again in Philadelphia.
Are you at all reconsidering the movement to green based on what you're seeing throughout the country?
We've been very clear from the beginning that our green depends on things continuing to do well here, and that there may be, we may have to postpone that, or we may have to take steps back depending on how the epidemic evolves. And that's true now, and that could be true at any point in the future.
And has this, though, changed your thinking in any way as you've seen these tremendous spikes in Florida, and even a few cases really going up now in Delaware, which also took a more conservative approach?
I absolutely am more concerned than I was a few days ago. Let's put it that way. And so we have to watch this very closely. And that's what the real key message of today.
All right. Thank you, Jeff Cole. Let's now go to Jacqueline Lee of 6.
All right, trying to start the video here. Okay, so we're talking about the heat. Obviously, it's getting very hot, but malls, libraries, and things are staying closed. So can someone talk about what residents can do, where they can go to stay cool if they don't have access to AC and things like that?
So we certainly are concerned about heat waves this summer. At the same time, we're experiencing a coronavirus epidemic. The things that we recommend ordinarily to protect people who are vulnerable to heat waves is to either go to a cooling center or to have a relative or someone, a friend, neighbor, invite you over so that you can get an air conditioning. Those are the same sort of things that put people at risk for the coronavirus infection. So it's difficult. Right now, fortunately, we're not in a severe heat wave. We do think that as the weather gets hot, that people should call their vulnerable relatives, friends, or even neighbors and check on them and see how they do. And if they're not doing well, see how they can help them. Many of them, they may be able to help by, people can have the windows open, fans going. There may be other people need some additional help. But at the moment, it's difficult. We don't have, we think putting vulnerable people together in one spot, like a cooling center, is dangerous for the coronavirus. We don't want to do that. And
I just would like to add, Jacqueline, before you move on, we have recognized this problem from the get-go. We knew this was coming, and we have a working group that is very focused on heat, getting sure spray grounds are launched. Our library should be open soon, as well as interiors of malls. So all of that work is ongoing, and we should have additional measures in place shortly.
Okay, awesome. And Brian, since I have you on here, revenue is down in every major tax category. So is this changing how you guys approach the budget?
As I think we talked about probably last week or the week before, we did see decreased revenues that caused us to have $750 million in a hole rather than $650 million hole. But that is all incorporated in the budget that council will consider on Thursday.
Jacqueline, you're still muted there. You want to unmute yourself. Jacqueline, you are, there you go. Go ahead.
There we go.
One more.
Yes. So, Brian, are you guys going to be changing where any of that money's allocated? Like, I know you said that you guys, put out the budget, but obviously because you guys have lost so much revenue, is any of that going to change?
At this point, I don't think so. So we certainly will continue to monitor this as we go forward. The council will consider the budget on Thursday, and then we will continue to monitor it and see if we need to make adjustments as the year progresses.
Okay, thank you guys.
Thank you, Jacqueline. Let's go now to Martin Pratt of Philly YBN.
Thank you for doing this. Dr. Farley, I did get a chance to look at the requirements for spray grounds and pools. Could you, for my audience, reiterate the city's reasoning for not opening the pools but opening the spray grounds?
Well, the pools will be reopened as of this Friday. We did not open them earlier because we were in a posture of saying, recommending against social gatherings of any size. And we figured if pools are open, people are going to be gathering at poolside. And if they were swimming, they probably would not be wearing masks. But we will be allowing them to open as of this Friday.
I'm sorry, the public pools run by the city park department.
So Martin, let me try and take a shot at that. I think we've covered this a few times. So the pools aren't going to reopen this summer for three reasons. The first was the logistics. To hire that many lifeguards, as well as to hire that many temporary workers, summer workers to manage the pools is intensive. And we were in the height of the COVID pandemic as that hiring would have normally happened. And lifeguards also require swim tests and other testing, and that wasn't being permitted at the time. So one is just pure logistics, operational logistics. The other was budget, not knowing where we were going to be from a health perspective. Budget was certainly part of it, but not the only reason, and probably not even the overarching reason. And then there's the health concerns that I think have made more clarity. So again, this is a multi-pronged decision, and spray grounds, while certainly not a substitute for a pool. Hopefully, our kids can, at least our younger kids, can have some fun and cool off.
Excellent, thank you, Dr. Farley. To the pools that will be open, from what I can read, is this considered structured programming? The recommendations that you have on the website for following the safety-wise, would that be considered structured programming?
I don't think we have anything labeled as structured programming, but I think there are specific guidance for pools, I believe, on the website. Okay,
that was it. Thank you, guys.
All right. Thank you, Martin. Let's go now to Jack Tomzik of Metro. Jack, you're up.
Yes, thank you. This is for Dr. Farley. I'm working on a story on this initiative to encourage people to test themselves for HIV at home. Is the health department seeing a drop in people getting tested for HIV during the COVID pandemic?
I have not seen those numbers. We can look at it and get back to you. I would not be surprised if there has been a decrease because many places are not providing services.
Okay, thank you. That's my only question.
All right, thank you, Jack. Let's go now to Laura McChrystal of the Inquirer.
Hi. Dr. Farley, I know you said that, whether or not Philly does move to green on July 3rd will depend on continuing to hit metrics. Some of my colleagues put together a graph that even shows, case counts in the last 14 days in Philly as of now, and the downward trend seems a bit unclear. It seems kind of up and down or inconclusive. Can you comment on what our trend is right now?
Yeah, the case counts do fluctuate from day to day, and so you have to look at a longer period of time to get a sense of things. Case counts have been falling, but as I said earlier, that the last week we're averaging about 100 cases per day. That's a little less per day than the week before that, but it's not much less. And so I'm concerned that we may be hitting a plateau here rather than continue to fall.
But it's still too early to tell whether we're at a plateau right now?
Yes.
Okay. Another question on, as we move toward reopening more things, on what enforcement enforcement abilities the city has on some of these things. Is the city going to be sending inspectors in to, for example, check capacity inside a store or a restaurant, or check that, outdoor tables are 6 feet apart and, employees are wearing masks, things like that?
Right, so the city will send our inspectors to the places where we can get, given the number of people we have, to observe the things that we can observe. So we will be in food stores and restaurants, for example, and we can observe the placement of tables, and we can observe whether people are wearing masks. Likewise, to the extent that licenses and inspections is in a store, they can see if they have barriers around the cash register. There are many things in our guidance which we cannot observe, and there are many stores. We're not going to be able to get to every store in the city. So that's why when we announced our plan, we said we really are going to inspect what we can, but we're going to have to rely on businesses and organizations to take this seriously. And we're going to have to rely on residents to help enforce these rules, to talk to someone who runs a business or an organization and say, hey, you're not really following the guidelines. Can't guarantee that's going to work, but I can guarantee that it'll only work if everybody takes that attitude that we all need to work on this together.
Okay. And my last question would be about the impact of recent protests. The city of Boston has come out and said, about 2.5% of people who attended protests and got tested positive. Did Philadelphia try to keep track of that in any way?
No, we didn't do that. That would require us asking people when they came in protesting if they had protested. And we didn't think that that was appropriate. We didn't think that they should have to tell us if they were protesting. That was sort of an invasion of their privacy. So we have no way of tracking that.
Thanks.
All right. Thank you, Laura. Let's go now to Argenis Figueroa of Univision. Argenis, you're up.
Okay, thank you. You hear me?
Yes, go ahead.
Okay, thank you. Good afternoon, everyone. My one question is going to Brian, but I need Armando for translation. Armando, ¿cómo estás?
Buenas tardes, Argenis, ¿cómo estás tú?
Buenas tardes, muy bien, gracias. Armando, mi pregunta es para Brian y quisiera que nos explicara brevemente a la comunidad en qué consiste el plan Restore and Reopen y a cuántos negocios de la ciudad estiman impactar con esta ayuda y cuándo pueden aplicar.
The question is for Brian. We would like an explanation for the community in regards to the Restore and Reopen plan. We would like to know how many businesses will be helped by this plan and when do you expect to put it into practice?
I believe Argenis, you're speaking of the Commerce Department's funding that is available.
¿Estás refiriéndote a los fondos disponibles del Departamento de Comercio, Argenis?
Tengo entendido que hay como una especie de plan para ayudar a los negocios, a los pequeños negocios que resultaron afectados por las protestas. Entiendo que este plan vendría a ayudar a estos negocios.
I understand there's a plan in place in order to help the small businesses that were affected by the protests.
Yep. So I don't have those numbers with me today, but we can certainly get back to you with those details.
No tengo las cifras disponibles en este momento, pero obviamente puedo regresarte a dártelas más adelante.
Ok, perfecto. Pero ¿tiene alguna noción de en qué consiste este plan?
Do you have any idea of what this plan entails? Some details about it?
I am not the best to speak to the plan. I can provide broad swaths, but we can certainly connect you to the Commerce Department, who's better equipped.
No tengo yo la mejor información respecto a este plan, pero te puedo poner en contacto con el Departamento de Comercio, que sí lo tiene, para que lo puedas obtener.
Sí, perfecto, lo agradecería. Muchas gracias.
Thank you very much.
And Argenis, if you referred to the press release that we put out yesterday, we did have some information about the program, and obviously let us know if you need more.
Okay.
It is a fund, just so we're clear. Let's go now to Manny Smith of CBS 3.
Good afternoon, guys. I want to clarify one question. There was a headline out there online saying that the July 4th fireworks for Welcome America will be canceled. I thought that was canceled already with the initial Welcome America celebration. Is that not the case? And if so, what was the decision behind canceling the city's July 4th fireworks show?
Yeah, thanks, Manny. I actually haven't seen that headline, but yes, my understanding, if I recall correctly, that was previously announced.
Okay, cool. All right. So I'm on the right track there. All right, that's good. So no July 4th Parkway fireworks. Brian, I've got a second question for you. I know last week the city announced you guys have an RFP out for an investigatory task force to look at, the police involved incidents with protesters, including the incident on 676. Can you tell me where you are with that RFP and any other additional
Manny,
comments
we're still taking COVID questions. If we have time for questions on other topics, we'll get back.
Really? I thought there were a few other COVID questions, but I guess I will have to wait at the end.
No, just hang tight. We should have time. So I want to make sure we get in questions on the.
All right, then I do have one more COVID question. Heat on I know that the fountain, like Logan Circle fountain, was not on. The fountain that's at Love Park hasn't been on. Is there any plan to turn those on or provide those public amenities? I know spray grounds are one thing, but we're just talking about public amenities where people can go to cool down.
Yep, that's a great question. That's something that we're under discussions with the Department of Public Property and Parks and Recreation. So I can't tell you right now if and when they're going to turn on, but it is certainly something we're just talking through.
Okay, thanks.
Yep.
All right, now let's go to Kennedy Rose of the Philadelphia Business Journal. Kennedy, you're up.
Oh, hi, everybody. Can you hear me?
Yes.
Okay, perfect. So this question is for Dr. Farley. I was just wondering, is there anything that the business community can or should be doing to make contact tracing easier for the city?
Well, one thing they can do is keep records of what people are there. We are not requiring restaurants, for example, to have people keep a log of who's dining there. But if they do keep a log and someone is diagnosed as a case and our contact tracers call, then they would be able to say, here are all the people who might have been exposed and have their cell phone numbers. We don't think we can require that, but certainly restaurants can do that, and that would be very helpful. And that sort of information is useful to us and in other settings as well.
Alrighty, that was the only question I had. Thanks so much.
All right, and finally, at least on this topic, let's go to Brian McCrone of NBC 10.
Hey, well, mine is actually related to the cooling center. I have a cooling center question. I guess it's COVID related. Yeah. You spoke a little bit about this already, Brian, but I just want to come back and ask you. You said libraries are scheduled to open soon. I think. I just want to know, basically, where it's supposed to be an unusually hot summer, and the 90-degree threshold is already being hit today, I think, and then we could have like 3 days in a row of 90s starting as soon as Saturday. So, where is the cooling center discussion? How long are you planning on having an announcement this week on that, or later, or what is the plan for cooling centers?
We're hoping to have an announcement shortly. I don't know if that'll be this week, but certainly in the very near future. So we have folks working on that issue in order to get it resolved. And I think Dr. Farley referenced this pretty well. These are difficult times as we're trying to manage actually multiple health crises regarding heat, certainly, and COVID. And trying to make sure that people stay safe on both fronts. So, this is not, we didn't just wake up yesterday and realize it was going to get hot. So we have folks working on this issue, and we hope to have an announcement shortly.
Okay, very good. Thank you.
All right, thank you, Brian. And now we will go to a second round. We are open to questions on other topics, and let's go to Jenny DeHuff of Broad and Liberty.
Thank you. Okay.
Go ahead, Jenny.
Oh, awesome. Thanks. I'm trying to hit record on my computer too, so I can record what you're saying. Give me 1 second. Forgive me. Okay. So my question is, I know the mayor isn't on today's call, so maybe this is for Brian. There is a march planned this afternoon at Broad and Snyder against, quote, racist vigilantes and their cop allies, calling to defund the police department. Photos have emerged online on social media of shopping carts filled with bricks in South Philly. And even Bob Brady wouldn't speak to me on background, calling the conflict, quote, too damn volatile. Is the city at all worried about this?
Sure. So we're certainly aware of the protest, and I will say the protests over the last week or so have been very peaceful. The organizers have been cooperative and I think follow their First Amendment rights to demonstrate in peace, and that's appreciated in large part. obviously, we've had some tensions in South Philadelphia. I will speak to the shopping cart specifically. We're reviewing that information. That shopping cart may have actually just been construction debris that was left, and dumped, and not any nefarious purpose. So we're still trying to review that and understand exactly how that derived. I will say that, these folks have every right to protest. They have every right to make sure that their voice is heard. And I would encourage residents and others to let them have their voice, and not to escalate tensions. And certainly, if residents want to have their voice, I think that's perfectly fair. But that confrontation, that escalation, doesn't serve anybody's purpose, and puts our officers in greater risk. So certainly would like to avoid that, and commend our officers for being able to at least generally maintain the peace between in these very difficult and volatile times.
How prepared are police for the type of demonstrations or rioting that we saw on the dates of May 30th and 31st?
I think our department's very well prepared. Obviously, by all indications, we're not looking at the same types of crowds that we saw on May 30th, which was largely the issue that police faced. And so I feel like our department's well prepared.
Okay, thank you very much. That's all.
All right, thank you, Jenny. Let's go back now to Manny Smith of CBS 3. Manny, you're up.
All right, Brian, I think you know what I'm going to ask. The RFP task force, where are you with that investigation, particularly with what happened on 676? Any additional comments or reflections or movement on that particular incident that you might want to add comment on?
Sure. So we're working as expeditiously as we can to get someone under contract in order to do that full after action, not just of the incidents on 676, but on our both our preparedness and our response to all the demonstrations. And that is one piece of a much larger reform conversation as it relates to some of the efforts that the administration had already announced regarding collective bargaining, citizen oversight, and state legislation. So there's a number of things that we are currently working on, and we'll be driving those efforts forward over the next not just a couple weeks, but this is going to be, if we're going to do this well and we're going to do it right, it's going to take some time.
Any of those, is there a cost associated with the RFP at this point, and how many bids have you gotten so far?
Not yet. I'm not sure that the RFP has actually been issued yet. We're still we're trying to, again, expedite our normal contracting process is rather lengthy, and we're trying to expedite exactly that timeline and make sure we can get bids in quickly and go to bid and get somebody under contract.
No problem. Of the people who were involved in that incident, do you know if the city has received any complaints from anyone who was injured or felt like they were not treated properly by police during that incident, of the people who were involved?
We've gotten a number of complaints throughout the demonstrations. I can't speak to how many and what were the circumstances for each of them, but I know we've received a number of complaints for the demonstrations.
All right. Thank you, Brian.
Thank you, Manny. This is the last call for questions on any topic. All right, seeing none, that concludes today's daily briefing. Just this note that we had been on a Tuesday-Thursday schedule. However, this week, our next virtual press briefing on COVID-19 will not be Thursday, but will instead be Friday at 1 p.m. We will issue press releases Wednesday, Thursday, and Friday. Thank you.